This is the active mucosal disease with central perforation. The perforation is freshened and curvilinear incision is taken in the external artery canal and elevation was done. We infiltrated the 12 o'clock position to facilitate the one point infiltration which cover whole the external artery canal with gentle suctioning. Okay, we are elevating the epithelial layer all around. The elevation at the 7 o'clock position is a bit difficult. Okay, after elevating whole epithelial layer, the fibrous layer is being excised. This is otherwise known as the total annular excision. As this is very active mucosal disease, we think culprit is the fibrous layer in the case of this type of diseases, extensive disease. For the ventilation block also, we think fibrous layer contributes to the maximum part of the pathology. Curitas was done and anterior and posterior tympanic isthmus is being cleared by one method called the skeletonization of the chorda tympani and skeletonization of the handle of the malleus after removing the posterior malleolar fold. All the mucosal overhangings and the mucosal blocks being relieved at the site of anterior tympanic isthmus. The tip of the handle of the malleus is touching the promontory, that's why it's being cut. The patency of the anterior and posterior tympanic isthmus is achieved and the skeletonization of the chorda tympani was done. There is extra mucosal tag is present anteriorly which was removed. The mucosal tags around the malleus was removed anteriorly also. Anteriorly we are seeing the mucosal layer support for the cartilage island graft. Okay, there is a groove for the malleus handle. Okay, the perichondrial flange was kept all around the bony annulus, bony tympanic annulus for the support. There is a small amount of discontinuity in the graft inferiorly, which is done by keeping small cartilage piece inferior quadrant. Okay. After keeping the mucosal perichondrial support all around the tympanic isthmus, that inferior part is handled by keeping small cartilage in the hypotympanum and by keeping the additional perichondrial layer all around the tympanic external artery canal wall bony support was taken. Graft was supported 360 degrees on the bony wall. The epithelial layer is being reposited back. See the anterior hump, that area also nicely cleared. This is a 30 degrees angle scope. The graft is checked 360 degrees. The perichondral layer is also checked. Okay, we keep the PRF sheet at the anteriorly to buttress the graft. Thank you for watching.